Hey there, malcontents. The malcontent here. Got your Washington State COVID update for Friday, January 14th. Let's go ahead into it. New cases. The entire state of Washington is experiencing extreme transmission. Puget Sound, you've dropped down off of what I would just call off the charts transmission. North Central region, you've moved up into off the charts transmission. We'll get into what all that means in a little bit. Hospitals across the entire state of Washington are either in critical state or are extremely stressed. Let's take a closer look at those numbers. All right, we have 2,135 hospitalized COVID patients in the state of Washington. That is a new record. 7-day moving average right under 1,900, also a new record. That is an increase of 50% from a week ago, and that is an increase of 136% from 2 weeks ago. Another thing, the data is incomplete. There is so much hospitalization data coming in to the Washington State Hospital Association. They can't process it fast enough. So there's actually more people hospitalized than what's in this report. We're going to have to kind of start looking 3-4 days behind to go, okay, that's probably the closer number. We're going to go ahead and leave that error in there. We're going to go to the next slide. Washington State's got 7,105 hospital beds. We estimate there's 404 acute care beds available left in the state. I'm going to explain in a minute why that number went up from yesterday. It's like, wait a minute, more patients, but more beds. There's a reason why that happened. ICU, there are 1,161 beds. There's only 92 available in the state. That is also up just a little bit from yesterday. We estimate there are 1,806 acute care patients and 329 ICU patients with COVID in the state of Washington. That 1,806 number, that's a record. 163 on ventilators, that is half of the patient census that is in the ICU. So where did these beds magically come from? Yesterday, Jay Inslee had announced that they were ordering in the state as part of this supporting the hospitals that no non-urgent surgeries could be done in the state of Washington for the next 20 days. This freed up an area in hospitals, and not all hospitals, but some hospitals, called PACU. If you ever had surgery, you don't wake up in surgery in a little town hospital maybe, but you're not going to wake up from surgery in the bed in your room. You wake up in a different place and not in the surgical room. That is called PACU. Those PACUs, by suspending surgery, have become available to put COVID patients in them. So that's where those beds came from. That's why the number went up. Those beds are wiped out. By this evening, those beds are wiped out. Let's go around the horn. We'll go through the regions, the East Hospital region. So that is Northeast Washington, Spokane, the Metro Spokane area, and the Palouse. New case rate, 736.2, high transmission, all counties. Your hospitals are wiped out. Now, you might be looking at that going, it's 92.9. Both Providence and, I wanted to say Peace Health, both Providence and Multicare, they're 100% full. And they are the backbones of the hospital networks that you have in that part of the state. The North region, that's the island counties, and that is the Canada border counties. Your new case rate is going up. You're at 909.9. That is extreme transmission. Your hospitals, same thing. At 97%, you are fully occupied. 20% of your acute care patients are in there with COVID. And your ICUs, 28% of your patients are in there with COVID. North Central region, that is the east slopes of the Cascades, Lake Chelan, and the Dry Lakes area. Your new case rate, 1,047.4. Anything over 1,000, we call off the chart. Your hospitals are extremely stressed. You're at 82.9. Your ICUs are almost at 93%. You're at almost 1 out of 3 of ICU patients are in there with COVID. Anything over 30 is very stressed. Northwest Hospital region, that is the Olympic Peninsula. Some good news. New cases have peaked. It's going the other way. Very, very clearly, you have hit peak in these counties. So you're still about 7 weeks away from where you could start to go, oh, maybe we're getting back to normal. You're at 680.5, which is extreme transmission, but it is going in the right direction now. Your hospitals are completely full. At 97 point, that's zero. Your hospitals are completely full. In your acute care, 23% have COVID. In your ICUs, 29% in there for COVID. Puget Sound, King, Pierce, Snohomish County, good news, peaked. Very, very clearly starting to go the other way now. So good news in those counties. Hospitals are, again, completely past capacity. Acute care, 1 out of 3 in acute care are in the hospital because of COVID. ICUs, 28% in with COVID. Next one, South Central Hospital Region. South Central is the Washington wine country. That's Yakima, Tri-Cities, Walla Walla. Your new case rate is starting to skyrocket also. You're up to 897.4. Your hospitals are very, very stressed. And that's the state that you're in there. I suspect that when we come back here on Monday, you're going to be in that critical state. This is where Omicron showed up last in Washington wine country, and you still have a way to go for peak. Southwest Hospital Region, that's Clark County, Vancouver, that's in the mouth of the Columbia River. That is the southwest corner of Washington State. You're at 729.2. That is, again, extreme transmission. Your hospital's completely full. At 97.5%, you got nothing left. 23% of all hospital patients, acute care, have COVID. In the ICUs, 29%. And I've said this multiple times. I'm very worried about Clark County in particular. You're not to peak for your cases yet, and I'm really, really concerned on how hard you're going to get hammered down there. All right, the West region, that is Olympia and the Pacific Coast counties and those counties that connect them together. Good news, you've clearly hit peak. You're at 582.3. Those wrestling matches back on December 4 that were in Thurston and Pierce County, they brought your region first to the party. So not only are you peak, you probably peaked at the earlier part of the week. You're maybe 2 weeks away now from the hospitalization peak. And if we look at what's going on there, your hospitals, you might be looking at this and going, well, they're under 90%. That doesn't look like full. 1 out of 3 patients in acute care have COVID. Almost half in the ICU have COVID. These take up massive amounts of resources, these patients, and that is why that number is lower, because the bed's there and technically the staff is there, but the staff is working on trying to keep these COVID patients in acute care from going to ICU and the COVID patients in the ICU from trying to keep them so they can go home and not go to where we don't want them to go. I'm going to close up. I've got a couple of little stats, and then we're going to go ahead and end this here. In Washington State, every 5 minutes and 15 seconds, another person is admitted to the hospital with COVID right now. The other stat I'm going to drop on you is this. In King County, every 6 hours, another person dies of COVID. The mortality rate is starting to curve upward at this point, which is what we would expect to see as we're reaching peak cases. Last thing I'm going to say, because if I called out that you're in peak, that means your region has peaked for cases. If I didn't, that does not mean for you to go, oh, okay, he said peak for them, so we've peaked. No, it's going to hit different regions at different times. I had mentioned when I was talking about the South Central Washington wine country, you're probably going to peak last in the entire state of Washington because the surge came into your particular region last. If we look at eastern Washington, it looks like that north central region, the north slopes of the Cascades, Chelan, Dry Lakes area, all the way up to the Canada border. I think that's the next. I think you will be first to peak for cases. Spokane, you're not there yet. I'm sorry. Because it's like, sorry, why? Because when we see the peak, then we have an idea of where hospitalizations are going to go. And the reason I'm closing with this on the West Hospital region slide is this is a region that's maybe 4, 5, maybe even 6 days past peak at this point. And we're looking at this hospital utilization numbers and the percentage of people now that are in the hospital for COVID. These are numbers that are far worse than what South Africa saw, and there's reasons for that. But I'm not going to go into that on the update. We know what to do, Washington. Get vaxxed, get a booster, wash your hands, wear a mask, socially distance, plan those grocery trips out. We got to do this to protect our hospitals. Malcontent out.